Thank you very much. There's a vote on shortly on the floor of the House, and I just have a few minutes, but I did want to come by to thank each and every one of you for your commitment to health care for the American people. It's very interesting that at a time when the demand for health care reform is the highest, those who have benefited from the current system are simply trying to find new ways so they can capitalize on the demand for reform, but really keep things essentially the same. The call for a Massachusetts-style plan really still keeps us into the realm of insurance care instead of health care. And just as the call to do something about all the people who are foreclosed still keeps us in the realm of bank care. And so while it is true we have a moment that's very powerful and a huge opening to, for the first time in generations, truly address the broad-based healthcare needs of the American people, the forces of resistance are going to be organizing to try to present a point of view that suggests that what they're proposing is true reform. What you're doing today is being able to identify the flaws in the plans that are likely to be offered and promoted as reform. It's really important to start getting that message out now. Don't wait. We need to move in local media. We need to move with letters to the editor, op-ed pieces, with communication on the web to the broader American community so that people will know in advance of this discussion that's happening nationally that individual mandates just aren't going to work. I mean, if people had money to buy health care, they'd take care of it. There's a reason why there's 50 million Americans underinsured. It's called premiums, co-pays, deductibles. There's a reason why another 50 million are underinsured. People just can't afford it. So individual mandates really do nothing to address the realities of health care in America. Now, what's really going on here is that the insurance companies are going to do everything they can to protect their position. But I think that the tides of history, which brought us dramatic change in 2008, are also with us on health care. This is the way that you stimulate the economy permanently. This is the way that you help rebuild America's manufacturing base. This is the way that you create a shift in health consciousness in the country. This is the way that you make for a healthier population. I mean, we have history moving in our direction here. And all the work that all of you have done at a grassroots level becomes critically important now. We may find that there will be differences of opinion with the White House, but I think it's important to engage. Yesterday, I talked to President Obama, Rahm Emanuel, and David Axelrod, all about, just briefly, all about the importance of having this point of view that we're talking about here today represented in the councils that are gathering in the next few weeks. Very important. So I want to pledge to you my own personal efforts, as well as working with John Conyers and other members who have shown leadership on this, in continuing to insist that we know how to do this. We know what the solution is. We know a time-tested solution that's worked all over the world. And that this is the moment, finally. If you could keep this in mind, when people say, well, how are you going to pay for it? Well, we're already paying for it. We know that's the answer. But the other thing is that if it requires changes in our monetary policy, remember, we've given the Fed the ability to create money and spend it in the circulation for the purposes of propping up the banks in Wall Street. Part and parcel of healthcare in America, if people are saying, well, you just won't have the money, may involve a shift in monetary policy where the government finally reclaims the ability to create money that would be given to the Fed anyway, to spend it in the circulation for healthcare, for education, for infrastructure, for jobs. So this argument about healthcare is central to reclaiming a democratic economy and to being able to surmount the very serious economic crises which we find ourselves in. I want to thank each one of you again. This wouldn't happen without you. Those of us who are up here depend on you to bring these programs to awareness at a grassroots and to create the movement. The movement is there. Our time is now. Thank you.